Thank you very much and good afternoon. Today, as well, I want to start by wishing everybody a happy Diwali and Bandar Chor Divas. I know this is an important time to celebrate triumph over hope and despair and the coming of light over darkness. And that is something that all of us can think through and be part of. And as we heard the news today about Premier Horgan and his cancer diagnosis, I also want to extend my thoughts and happy thoughts, because I know the Premier and his family are taking this on with positive and strength, and they will be strong and positive throughout this, and we're sending our best wishes as well. And also to our many healthcare workers and families across this province who are dealing with similar issues. All of our healthcare workers in BC who continue to go to work every day to provide that care for people across the province, and the very best care possible. And my gratitude goes to you as well. So today I'm also going to be providing the latest epidemiology data and modeling update to give a little bit of a sense of where we are here on November 4th in this pandemic. So to go back to some of the images that will be familiar to people who have watched these updates over the last year and a half, or almost 21 months now. This is the Epi Week of last week, so ending on Saturday, and it shows where we are seeing the most cases. So it's the case rate by local health area of residents of the people who are infected, and what we see is that we still continue to have challenges across the north. No surprise to people in many communities in the north. On a positive note, we are seeing cases come down quite dramatically in interior health, which is great news, and remaining low, particularly in those areas of the province where our vaccination rates have provided that buffer, where the virus can't spread as easily. We continue to be affected across the entire province, and this is a cumulative case rate since the 1st of January in 2020 up until the end of October. And some areas have been more impacted than others, but there is no community in this province that has not been affected by this pandemic. And I don't need to say that to people here today. On a positive note as well, what we see is the geographic distribution of vaccination coverage, and that has become increasingly high. And our coverage now is up to over 90%. This is age 12 and above for first dose coverage. What we also can see is that in those areas where coverage is not as high, in those pockets where vaccination rates are not as high, those correspond to areas where we see increasing transmission. And I've just put the Lower Mainland up as an example where we can see this side by side. If we look at the coverage rates in the Lower Mainland, in the Fraser East region, those are the areas where we still see persistently high case rates. And as we'll see as the data goes on, where we're seeing people hospitalized from this virus. This is our epidemic curve, starting in January 1st to the 1st of November this year. As you can see, the green line on the top, we've had grumbling cases along for the last few months since that rapid increase driven in interior health in the summer. We are seeing a steady decrease, particularly in the last couple of weeks with the putting in of new measures in particularly in northern health. What is concerning on this is the persistently high, stubbornly high rates of hospitalization. And we'll look a little bit deeper into who is being hospitalized and why and where in some of the data that I'll present now. This has been the challenge for us over this last few months. It has been the reason why we've done things like making sure that healthcare workers are vaccinated, making sure that we get booster doses out to where we're seeing people having breakthrough infections. But it is also a reflection of the fact that the Delta virus is spreading more easily and causing more severe illness in younger people, particularly those who don't have the protection of vaccination. So if we compare, for example, our cases and hospitalizations in people who are unvaccinated versus fully vaccinated, the difference is stark. This really is driven by the number of people who are becoming infected, who have not yet been vaccinated, and the hospitalizations reflect that as well. If we look across the province, this is the case incidence, so the number of cases, test positivity, and that the colors reflect the percent, the rolling, 7-day rolling average percent positivity, and the testing rate. And the testing rate, we say, across the board has remained high. And what we are starting to see in some of those stubbornly high areas is now a decrease in the percent positivity and the case incidence rate, particularly in some of the areas of the interior, and now, just more recently, in the north and the northeast and northwest in particular. This is the epidemic curve by health authority, and we can see that Fraser Health still has the bulk of the cases, although this last wave has been driven initially by a rapid increase of cases in interior health that have finally now started to settle down, and of course the recent cases that we're seeing across the north. When we break this down by age, last time we presented the update of the epidemiologic data, we were right as the 9 to 11 and 5 to 8-year-old age group was going up. As we can see, it has dramatically come down, and I'll show you a little bit more data about the school-age children a bit later, showing that our testing rates still remain high in that population. So this is a true decrease, and it's related again to decreases in communities that is reflected in the rates that we're seeing in school-age children, and particularly in those children who are not yet old enough to be vaccinated. Finally, we're also seeing a decrease across the board, with the exception of people over the age of 80. And where we're seeing this is people who are infected in some of the long-term care outbreaks that we're seeing, but also community seniors in our communities who, particularly the small number who are not yet vaccinated, and the risk in that group is very, very high. So if we break again the age distributions out by vaccination or not vaccinated, it really is a predominantly unvaccinated population where we're seeing infections take off, and where we're seeing higher rates of infections in the younger age groups. Thankfully, the youngest age group, the 0 to 11, who are not yet eligible for vaccination, have the lowest rates, and those rates have been coming down. When we look again at hospitalizations, so the numbers of people in hospital in the top and the rate per 100,000 on the bottom, we see again that in younger people, 0 to 19-year age group, that remains low. And this is something that we have been following, of course, since the summer in particular, when we started to see increased rates of children being hospitalized in the States and in some parts of the country. Thankfully, we have not seen that here, and we know that part of that is protection that's afforded by those around young children being vaccinated and by the measures we've taken to protect young children. Where we see the rates going up, as I mentioned, in people over the age of 80. And some of that is related to breakthrough infections in people who are fully vaccinated. And we know that happens because our immune systems aren't as strong as we're older, as we get older. And because they were at the highest risk, our seniors and elders have always been disproportionately affected during this pandemic. And we prioritize people over age 80 to be immunized early on. And many people received their immunization at a shorter interval. And we now know that that extended interval between dose 1 and dose 2 does indeed, as we expected, give longer lasting, stronger protection. So this is one of the reasons we have prioritized people over the age of 70 across the board to receive booster doses, and that has started in the past week. This is just an update again of the impact of the pandemic across the age groups. We can see that younger people under the age of 10 are still underrepresented compared to the proportion of younger people in the population, and that the main burden of this virus and the pandemic has been on people over the age of 50, and particularly people over the age of 70. When we look at vaccination progress, we can see that we've made tremendous progress across the board. So we are at about 90% coverage of people over the age of 12, and that is fantastic. But it also reflects that that small percentage of people left is still has a tremendous burden on our healthcare system. And if we look at all ages, so our entire population, we're about 80% of the entire population that's been protected through vaccination. And we see in communities where those vaccination rates are high, how protective that is at preventing the virus from spreading, even if it cause mild illness in some people. So when we look at then the proportion of people who are unvaccinated who become cases, about 60% of the people who were infected with COVID in the month of October are from that 10% of people who are not yet vaccinated. And the vast majority of hospitalizations, 72% in the month of October, and over 90% of the people who required critical care are people who are not yet vaccinated. When it comes to the small number, thankfully, of people who've died from COVID, about half of those people are not yet vaccinated, mostly younger people, whereas we know that this virus can still have devastating effects on older people in long-term care homes if it gets into that setting. And this is a summary, we call it our placemat, of looking at the vaccination rates across the top, and then that small gray portion, the percentage that result in cases, and on the right-hand side, the bars show the age. So what we see is that the number of cases in people who are unvaccinated at a younger age is much higher, and importantly, the hospitalizations on the third row down, we are seeing unvaccinated young people being hospitalized, and sadly have seen deaths in young people who are unvaccinated. Most of the hospitalizations and the deaths in people who are fully vaccinated are in those who are older with underlying conditions whose immune systems aren't as strong and able to prevent severe illness if they do have breakthrough cases. But really, what we look at by age, you can see the dramatic impact of protection that vaccination gives across the age span. That purple line that's relatively flat on the bottom is consistent across the age groups, that these vaccines are highly, highly protective at preventing severe illness, even in older people who get infected. And this is really putting it all together. When we look at it by age, so this is adjusted for age. So a 50-year-old person who is unvaccinated has a 10 times increased risk of a same age person who's been fully vaccinated of becoming infected with COVID. The risk of hospitalization is 50 times greater than somebody the same age who's been immunized, and 46 times greater risk that they're going to succumb to COVID than somebody who's been protected through vaccination. These are the important things that help us understand how well these vaccines are working and how they are protecting people. I want to talk a little bit more about the pediatric groups, so our children, particularly school-age children and young children. We've been following this very closely, as we've mentioned. So in the past epidemiologic week, we've had one additional case admitted to hospital in the 0 to 4, 5 to 11, and 12 to 17, one each in those age groups. And there's been two children, one in the 5 to 11 age group and another child 12 to 17 who've been admitted to critical care. We've had no additional deaths in any of these ages, which is good news for all of us. If we break it down again by geography and age to help a better understanding of where children are being infected and at what age, we see that it does vary tremendously by the rates of transmission in the community. And again, those reflect the rates of vaccination in our communities. So we see in the interior, in the 12 to 17 age group, where immunization rates have come up quite dramatically in many communities, that we've seen a steady decrease in cases in children who are vaccinated. As well, we're starting to see the corner turn in Northern Health as immunization rates go up. But it still shows us that the impact is much more felt in communities where vaccination rates are lower. And again, breaking this down by unvaccinated versus vaccinated, particularly in the 12 to 17, I think this is really important for us to realize. Hospitalizations are low across the board for children. That is good. That's important for us to know. But there have been no hospitalizations, none in the past month, since July, in fully vaccinated youth. So children at 12 to 17 who've been protected by vaccination, it is working extremely well. We've had very few cases and we've had no hospitalizations. That's important for us to think about as vaccines are now becoming available for the younger age group as well. And this is just to show that we are continuing to test at very high levels. So we are looking for cases in young people across the spectrum, and the rates and the percent positivities are coming down dramatically. So that's important for us to remember as well. And finally, I'm going to talk a little bit about our update on our modeling. So this is the reproductive number, RT, and for the first time in several months, across the board, we've dipped down below 1. What we have been seeing is sort of bouncing around at 1, which means for every person who's infected, they infect one other person on average. Now we're seeing that below 1. That's good news, but it's just below 1, which means that we have right now a fragile balance. We're going down slowly. It is important for us to recognize that the things that we're doing to prevent transmission, including being sure we're vaccinated, getting our booster doses, staying away from others if we're feeling sick ourselves, managing the size of our gatherings, particularly if people are unvaccinated in those settings. These are all the things that are making a difference right now. But we are going into the respiratory season. We've started to see influenza appear on a horizon. We've started to see RSV cause some infections, particularly in children. So this is not the time to let off in any way what we are doing to protect ourselves, our families, and our communities. And finally, the modeling, the transmission scenarios that we've been using. As we talked about the last time we presented this, we're looking at the shorter term implications given what we've seen in the past about modeling. And on the right-hand side, it talks about hospitalizations and on the left-hand side, hospitalizations, on the right-hand side, cases. And where we are right now, we should continue to see a steady decline in cases and hospitalizations over the next month. But this is a fragile balance that we're in. But it is an important balance. And when we look at what we could be at had we not had vaccination, right now, we would have been in a very different situation in this province. And, people have asked, what is it that's keeping the hospitalization rates up? Why is there so many cases and transmission? And part of the answer is the strain of the virus that's circulating right now is that much more transmissible and is causing more severe illness in younger people and in people who aren't vaccinated. And if we had not had the protection of immunization that we have had across the province, we would have had a much more challenging situation. So that's the update right now. And what does this tell us overall? That the risk is and continues to be dramatically higher for people who are not yet vaccinated. And I know that you've heard me say this, we've heard ministers say this over and over, but this is showing us how important and how protective and effective the vaccines that we have are. This is now a preventable disease, particularly severe illness, hospitalizations. Our seniors and elders continue to be vulnerable, and that is why we've rolled out the vaccine booster dose to them so quickly right now, and we know that we'll get to booster doses. We've managed all of our long-term care, assisted living, and people in the community are receiving their invites now to get your booster dose, and I encourage you to get this now. We're also focusing on healthcare workers who were immunized early, particularly those who had it at a reduced interval in December and January last year, because we know how important it is to protect you from any illness, even mild illness, because it can be so disruptive to our system. And while the North is continues to be more severely impacted right now. We've seen clusters and peaks in different areas across the province, and there's been no part of the province that has been unaffected by this, as we know. As well, we know what's happening in the north is having spillover in the hospital stretched systems across the province. Once restrictions are in place that limit the potential for the virus to spread, and we see that in the north, we start to stabilize and come down. This is important. The number of new cases on average for every case is now below 1, but it's just below 1, and this is where we need to keep it. We all need to continue to do the things our collective efforts are making a difference to slow the spread and to reduce the impact on our communities and our hospitals. So how do we stay on track? These are the 5 things I'm asking everybody to continue to do as we go through this next few months. Get your booster dose when it's your turn. Get your first and second dose now. These will protect you, protect your family, protect the people you're closest to. Get your influenza vaccine. This will help us to weather the influenza season, and we don't know how that's going to turn out, but we've started to see some transmission. Register your younger children and get them vaccinated. When we have vaccine available in the coming weeks, it will be important to protect them as well, and we are working to provide all of the information to parents so you can make those choices for your children. Remember how important it is now more than ever to stay home if you're feeling unwell, to stay away from others, to get tested if you need to, but all of those important things that we have been doing all along, washing our hands, staying away from others if we're feeling sick, and wearing masks in indoor public spaces when we're around other people and we don't know their vaccination status. I want to finish by saying thank you, everybody who's doing your part. It has made a difference, and we're continuing to make a difference. And we all need to remember that that is what is going to get us through this next few months and to the light and to a better and brighter few months ahead. Thank you.
Thank you very much, Dr. Henry. And just to underline the age-adjusted number, 50 times more likely to be in hospital if you're unvaccinated. 50 times. And I think it's important to reflect on that and why it's important that we did, I think, approximately 3,000 first doses in the last reporting period of vaccination, and why we continue to need to drive vaccination amongst the unvaccinated, particularly in some regions, but really across in every part of BC, from the central part of Vancouver Island to the north to other areas where there are significant rates of transmission today. I'm going to provide an update on surgeries and postponements, on mandatory vaccination for BC's healthcare workers, and booster doses in long-term care and assisted living. With respect to mandatory vaccinations for healthcare workers, approximately 2% remain unvaccinated. That's 3,091 workers total, and by health authorities. That's 573 in Fraser Health, 959 in Interior Health, 306 in Northern Health, 101 in Providence Healthcare, 399 at the Provincial Health Services Authority, 33 in Vancouver Coastal Health, and 485 in Island Health. I think that's actually a mistake. In Vancouver Coastal Health, we'll get you that number. I'll note that we're going to provide a breakdown tomorrow of some major occupation groups to give you a sense, but I'll tell you that there is not really significant differences between occupation groups. All of them do extremely well, are largely at 97 and 98%, all of our major occupation groups through the healthcare system. I'll make this point, though, and I think it's important to recognize how positively people have responded to the provincial health order with respect to mandatory vaccination. You will recall on October 20th, when we spoke about this and gave you the numbers for the first time, the numbers of unvaccinated workers in our healthcare system was 5,512. There has been, of course, some data cleanup since then, but also a lot of people have got vaccinated. And the results are a healthcare system that's safer for workers, safer for patients, safer for families, safer for the community. And I'm very proud of everyone who's been involved in that. I also want to note just something similar with respect to the order that was in place on October the 12th for long-term care and assisted living workers by sharing the following statistics. That on August 12th, 2021, when Dr. Henry announced the intention to proceed with mandatory vaccination amongst long-term care workers and assisted living workers, the number of staff vaccinated on that date was 45,357, or 90.1%. That number yesterday on November 3rd was 48,598 healthcare workers, or 96.5%. So that's an increase of 3,241 net in count and 6.4% in percentage. For second doses, those increases were 5,495 and 10.9%. What it says is what we know, that this order is necessary and important and has made our healthcare system safer for everybody. And we are, of course, going to continue to proceed with this requirement throughout our healthcare system in the interests of everybody, but in particular for those working in the system and for those who need healthcare at this difficult and challenging time. And we're going to, of course, continue to work with health authorities to address the impacts from unvaccinated staff. But I would say this, that the biggest risk to our health human resources is COVID-19. And these actions, these clear actions to make things safer and better are good for everybody, in particularly for those who work in the system, and as I say, vulnerable patients and residents. I wanted to provide an update on efforts to protect those living in long-term care and seniors assisted living. Booster dose vaccination is 98% complete in long-term care and seniors assisted facilities across the province, with 526 of 536 facilities receiving their booster dose to date. That's 100% of sites in Vancouver Coastal, Northern Health, and Fraser Health, 94% in Island Health, that will be finished in the next day, and 98% of the sites in Interior Health. And finally, as we reported on Monday across BC, most operating rooms continue to perform surgeries, although there have been, as I've noted, reductions. As many will remember, when we started our weekly surgical reports, when all non-urgent surgeries were suspended across the province back in March and April of 2020, we noted that in addition to scheduled surgeries being postponed, others were not booked during this time. And on a much smaller scale, that's what's happening now. What we said in May 2020, when we launched our surgical renewal commitment, stands true today. Our commitment is to catch up with surgeries lost to COVID-19 and keep up with demand for surgeries now and in the future. No matter what challenges we face, this remains our commitment, and we will see it through. And as we have week after week since we made our surgical renewal commitment, we will monitor our progress and report on our efforts in fulfilling that commitment. And with that, here's this week's report. You'll recall that, or I should say that during the reporting period of October 24th to 30th, health authorities postponed 238 non-urgent scheduled surgeries. That's 31 in Fraser Health, 12 in Northern Health, 61 in Vancouver Coastal Health, 71 in Vancouver Island Health, and no surgeries were, 61, in Interior Health, and no surgeries were postponed in the Provincial Health Services Authority. From September 5th to October 30th, there have now been 2,389 surgical postponements. I want to note this. In the period from October 2nd to 9th, 7,004 surgeries were completed in that week, which is, I think, a significant achievement and really similar to some of the highest levels of surgeries we had in the pre-pandemic period. And this is an extraordinary achievement given the challenges in acute care. It shows how hard and how determined our staff is in providing care to people. From October 10th to October 16th, health authorities report 5,582 surgeries were completed. I'll note that that week included Thanksgiving, so there was a statutory holiday in that week, which is responsible for the largest share of the lesser number than the previous week. But it's also a significant achievement. So when you look at the numbers of surgeries canceled in a week or postponed in a week of 200 and those completed, in the week of October 2nd to 9th, 7,000, you'll see that overwhelmingly people are getting, both for non-urgent scheduled surgeries and, of course, in all cases of urgent scheduled surgeries, the care they need. I'll say finally about our healthcare system and where we sit. Right now, we have, as all of you know from these briefings, 9,229 acute care beds, base beds in our province, and 2,353 surge beds. We have 510 base ICU beds and 218 surge beds. And just to give you a sense of where we are right now, of those 11,582 beds, the 9,229 base beds, our census, that means everyone in healthcare today, which is a key number that we use in monitoring our system, is 9,199. So it's under our base bed capacity and under where we were in the pre-pandemic period, but still extremely challenging given the particular challenges of COVID-19. In ICU beds, we have 480 beds occupied today out of the 510 base beds. Of course, there are 728 base and surge beds. That gives you a sense of where it is, where those numbers are. It shows a healthcare system that is delivering an enormous amount of, in terms of services for people, of surgeries, and of care for people, and at the same time is challenged by 2 public health emergencies. And finally, just say this, 100 people now have been transferred, ICU patients have been transferred from the north to other health authorities. Since Halloween, since Sunday, 9 more have been transferred, 6 from the 2 Peace River local health areas. And what this tells us, what Dr. Henry's modeling tells us, is the absolute need to continue to increase our dose 1 vaccination and our dose 2 vaccination in addition to getting your booster doses when you are invited to do so. This is absolutely critical. Every one of those cases requires people being supported by healthcare teams at every stage of their journey. And of course, people who are facing serious health difficulties far from home. It fills me with awe for our healthcare workers in our communities and the work that communities are doing together to increase vaccination rates, from Mayor Ackerman in Fort St. John to MLAs, but mostly just to people in the community. We're seeing those rates go up more than 76% now, for example, in Fort St. John, and going up. I'm in awe of them and of our healthcare workers. We're determined. Everyone in the healthcare system is determined to support the North. 18% test positivity against 4% for the rest of the province. We must support the North, and we are determined to continue to do that through the BC CDC in supporting contact tracing and through the entire healthcare system in supporting patients in the North. But also, I would say, real sadness, because the vast majority of people who've been transferred are dealing with COVID-19. Some have other ailments and other problems and other illnesses which they are being supported for, and we need to provide outstanding care. But it is preventable. It is preventable. And I want to say to everyone today, look at the numbers, but imagine the people involved who did not get vaccinated, are in a community far from home, getting assistance in breathing. It's time for everyone, everywhere in BC, to get vaccinated against COVID-19. Thank you. We're happy to take your questions.